Let's discuss the extra point, the Shiquizhuixia below the seventh vertebra, and Jianqian, the front of the shoulder. EX-B-8 location on the midline below the spinous process of the fifth lumbar vertebra, L5. How to find? Locate the Tuffier's line and L4. Next, palpate in an inferior direction to the next vertebra, L5, and locate EX-B-8 below the border of its spinous process at the lumbar joint, lumbosacral joint. Located in the same level are point of EX-B2 bladder 26.5, 1.5 lateral to the midline. Needling 0.5 to 1 tune vertically to the skin or obliquely in an inferior direction. The patient's back should be straight or slightly flexed to avoid a spinal puncture. Oblique insertion in a superior direction should only be carried out by experienced practitioners, as in small persons, regardless of their weight. Spinal canal can be reached after only 1.25 tune. Caution, in pregnant women about to go into labor. This point might have a labor-promoting effects. Action indication, it tonifies the kidney, opens the channel locally. Location, this point is located on the midline of the back below the tip of the fifth lumbar vertebra. Actions, removes obstruction from the channel, benefits the lower back. So we have here the illustration, bladder 23, jingle, and the bladder 26 location. Indications, chronic or acute lower back ache. This point is excellent as a local point for the treatment of chronic or acute lower back ache, whether the ache is on the midline or bilateral. It is only used if the ache is quite low down on the sacrum or just above it. It is usually combined, this point, with bladder 26. This point is superior to DO3 or DO4 for the treatment of lower back ache. It removes obstruction from the channel, benefits the lower back, chronic or acute lower back ache. Combinations, chronic lumbar pain, bladder 26, bladder 53, and bladder 14. And BW25 was first mentioned in the supplement to the 1,000 Ducat formulas. It is among the most commonly used points for chronic back pain and is very often found to be the focus of tenderness. It may be used in both deficiency and excess patterns, and in frequently encountered clinical situations where the two are found in combinations. Next, the front of the shoulder, the EX upper extremity location on the midpoint of a line connecting the end of the anterior axillary fold and Li15, the Jianqian. How to find? Locate Li15 as the patient to actively abduct their arm and locate Li15 in the depression anterior and inferior with the acromion. Ventrolateral extremity of the acromion. The end of the anterior axillary fold is formed by the easily palpable lower border of the pectoralis major muscle. Jianqian is located on the anterior aspect of the shoulder joint, midway between these two reference points, leading vertically up to 1.5 tune. Action indication, it opens the channel and the lumen vessels locally. Location, midway between the end of the anterior axillary fold and Li15. Action, removes obstruction from the channel, spells dampness and cold. So we have here the illustration, the Jianneiling, Li15. Indications, stiffness and pain of the shoulder, difficulty in abducting the arm, feeling of heaviness of the arm, numbness. This is an extremely useful local point for the treatment of shoulder pain or frozen shoulder. Is selected when the pain radiates towards the anterior aspect of the shoulder, lung channel. This point is called as Jianqian, front of the shoulder. Removes the obstruction from the channel, expels dampness and cold, stiffness and pain of the shoulder, difficulty in adducting the arm, feeling of heaviness of the arm, numbness. Jianqian, also known as Jianneiling, inner mount of the shoulder is frequently palpated and needled if tender for pain in the front portion of the shoulder joint. In clinical practice, it is commonly combined with the other important points for treating the shoulder, such as Li 15, Li 16, Sanjiao 14, Si 10.